Parkinson's disease is a complex disease. There is no one single cause that can explain why people develop the disease and progress over time. And alpha-synuclein is a key driver of that, as we know. But there are many other factors, including inflammation or a specific target in the brain that are linked to inflammation on the microglia activation and lysosomal dysfunction. Only targeting probably all of them at the same time, we will be able to halt and potentially in the future prevent the disease by using the novel diagnostic tool that we have. Prasinezumab is targeting aggregated alpha-synuclein that seems to be one of the drivers of microglia activation. So by removing it, we should reduce microglia activation and potentially reduce the progression of the disease. But at the same time, it's also possible to target microglia directly, and there are several strategies that are currently addressing this problem. Because microglia is not only activated by aggregated alpha-synuclein, but is also activated by the neuronal loss, the membranes that are going outside. And we need to tackle the disease from different angles in order to halt and potentially prevent its onset.